بسم الله الرحمن الرحيم. أعزائي الطلبة، السلام عليكم ورحمة الله وبركاته. Our lecture today about aplastic anemia. So, aplastic anemia is a bone marrow failure syndrome characterized by peripheral pancytopenia and marrow hypoplasia. The bone marrow failure is the term with a large meaning referring to disorder of the hematopoietic stem cell, which involve either one cell line or all of the myeloid cell lines. This lecture consists of two parts. Today we discuss only aplastic anemia, and on the other lecture we discuss the anemia of chronic disease and polycythemia. So, pancytopenia, reduction in the blood count of major cells, which is the red cells, white blood cells, and platelets. The causes behind this decrease in bone marrow production or increased peripheral destruction, and this table shows you the causes behind the pancytopenia, decreased bone marrow function, aplasia, acute leukemia, myelodysplasia, myeloma, infiltration with lymphoma, solid tumor, tuberculosis, megaloblastic anemia, other paroxysmal nocturnal hemoglobinuria, myelofibrosis, and hemophagocytic syndrome, and increased peripheral destruction and the splenomegaly, which is enlargement of the spleen. Aplastic anemia, pancytopenia resulting from bone marrow aplasia. The pathogenesis behind this, the underlying defect, is substantial reduction in the number of hematopoietic pluripotent stem cells replaced by the fat cells, or an immune reaction against the bone marrow cells. This slide shows you the normal and abnormal aplastic anemia. Normal slide of cells in the bone marrow microscopically. So in the slide of the aplastic anemia show filtration with fatty cells, and there is no normal cells, which is present in the other slide. Also, this is compared between normal and aplastic anemia slide from the bone marrow microscopically. The causes of aplastic anemia, this table shows the primary and secondary cause. The primary congenital Fanconi and not Fanconi type, idiopathic, acquired, and the secondary, there is causes behind this aplastic anemia, like ionizing radiation, accidental exposure to the radiotherapy, or radioactive isotopes, or nuclear power station for those working in these stations. Some chemicals like benzene, organophosphates, and other organic solvent, DDT, previously used, insecticide, and other pesticides, organochlorines, and recreational drugs, drugs that regularly cause bone marrow depression, like Busulfan, Melaphan, cyclophosphamide, anthracycline, and nitrosurrogase. Those that occasionally or rarely cause marrow depression, example, antibiotic like chloramphenicol, sulfonamide, gold used for arthritis or anti-inflammatory drugs, antithyroid, psychotropic or psychiatric condition, anticonvulsant, and the antidepressant drug used for epilepsy or convulsion. Other secondary causes include viruses, example, viral hepatitis non-A, non-B, and non-C is most common cause. In addition to that, Epstein-Barr virus. Fanconi syndrome, most common type of congenital aplasia for the age of presentation from 5 to 10 years. The clinical feature present patient or this child with growth retardation, defect of skeleton like microcephaly, small skull or small head, absent of some bones like radius or thumb, defect of renal tract, urinary tract like horseshoe kidney, and defect in the skin, sometimes associated with mental retardation. This X-ray shows you the absence of the thumb on patient with Fanconi anemia, and on other slide using special hyelogram intravenous for patient show the kidney present in the abnormal place, which is in the pelvis. Idiopathic acquired aplastic anemia, most common type of aplastic anemia, 2/3 of acquired cases. Most of the time T-cell mediated autoimmune. The secondary acquired aplastic anemia, often caused by direct damage to the hematopoietic marrow by radiation or cytotoxic drugs. Some drug cause temporary transient aplasia, example methotrexate, antimetabolite, and other depressing and mutic inhibitor used in case of malignancy like in leukemia. Some drug might cause chronic aplasia like Busulfan, alkylating cytotoxic agent, also used in malignancy condition. Some patients develop aplastic anemia as a rare side effects of drugs that are not known to be cytotoxic, like chloramphenicol and gold. A blood count monitoring is required. Viruses infection like hepatitis A, B, and C, Epstein-Barr virus anemia occur during or a few months after the infection. Chemical, as we said, like benzene, malignancies such as acute lymphoblastic or myeloid leukemia, especially in children. The clinical feature presentation of patient diagnosis at any age, peak incidence around age of 30 years, slightly male predominance than female, onset is insidious or acute, severe cases have high mortality within 6 to 12 months. Less severe cases might have transient or chronic course with ultimate recovery. Relapse sometimes severe or often fatal. disease might transform from myelodysplasia or acute leukemia. The sign and symptom result from reduce in the red cells, sign and symptom of anemia, like paleness, anoxia, fatigability, and reduce white cells, increase infection. So any condition associated with depressing the protection system, particularly of mouth and throat, generalized infection are frequently life-threatening. Reduced platelet count, bleeding tendency, bruising, bleeding gum, abstracts, bleeding from nose, and menorrhagia in female. Increase the bleeding from vagina in females. This is okay. The life finding of this condition, anemia, normochronic, normocytic, or macrocytic, the MCV 95 to 110 femtoliter, reticulocyte count extremely low, leukopenia, usually granulocyte, but in severe cases, lymphocytes are also reduced. Thrombocytopenia, always present in severe cases, platelet less than 20,000 cells per liter, no abnormal cells in the blood film, bone marrow hypoplasia with loss of hematopoietic tissue and replacement by fat cells. The treatment, remove the cause, example, stop the drugs and radiation exposure as a secondary cause. Supportive care like for anemia is blood transfusion, for decreased platelet constraint, treatment or prevention of infection like use prophylactic antibiotics, specific drug anti-lymphocytic globulin, cisplatin and omeprazole androgen can be used. Stem cells transplantation. The red cell aplasia of red blood cells only, anemia with normal leukocyte and platelet, reduced or absent erythroblast in bone the marrow, can be acquired or congenital, can be chronic or transient, acquired can be idiopathic or seen in the autoimmune disease like systemic lupus erythematosus, SLA. Parvovirus infect red cells, precursor, transient, from 5 to 10 days. Red cells aplasia, rapid onset of severe anemia. Might occur with drug therapy. And thank you.